Cool. It seems like we're cooking with gas. All right. Right on. Okay, I'm on YouTube now. All right. Okay, so this link up here, or this share, that's the new link for this hopefully one-off thing that we won't have to deal with again.
And that's for anybody who wants to watch.
Yes. Yeah, so this is the new, I suppose, broadcast link. So I imagine you folks have a typical place where the meeting is that doesn't change, right? Or maybe it does.
I'm not sure what the question. What do you mean by that?
Oh, I don't know where you would post this link anymore.
Okay, so where would I get? I don't see the link, so I don't know.
Oh, okay,
Nancy,
sorry.
is that something you can see?
Yeah, sorry. I'm looking. I realized. Yeah, you can't see it because I'm not sharing screen. I am taking over Nancy's.
And I'm hearing sound coming out of two different places, and I'm confused.
Yeah.
Yes, because you will have this on. Let me mute that. Okay. All right. So we should be good, I think.
Well, I still don't know what link that is being talked about and what needs to be cleared.
Sorry. So.
And I don't know. Do you see that link, Nancy? Maybe
I do,
you can
and
share it.
he's copying it, and I think if you go to my Teams window, then you can go to the chat there.
It looks like power is back on. Is it?
Is that at Colin's house versus Chambers?
Oh, I don't know. Colin was at home, I guess. You're right. Okay,
Oh,
I don't see the link. I don't know what. So
Can you
yeah,
Nancy,
and Nancy, feel free to take over.
Okay.
I'm good here. Okay, so now it appears I also found out I can take over someone's computer. Okay, so that's the link, assuming power has not come back on, and you still need to, and we still need to. Oh, okay.
Well,
so, and also, if you want, Cynthia, near the top of the screen where it says YouTube, it looks like that drop down also has the link to the meeting on YouTube.
oh, okay. Copy streaming link. All right. Okay, now I see that. So I guess so where would I put that then? I have to send that to all the panelists, like every single person?
Oh, no. That's the link for what normally Create TV does.
Yeah.
The Create TV link.
Okay.
But I don't know.
So,
I don't know what you guys normally do with that, or where that's normally posted.
well, normally Create TV handles that aspect, but they left, so they're no longer doing it. So,
Cool. My guess is
Nancy,
actually, no.
I'm not sure if, because Dave mentioned something about sharing it to, sharing it to everyone. So to the mailing list. So is that all I have to do? I'm not sure.
I'm sending a message. Did you get the APIs to send it to Dynamic?
Yeah, I did already, and I'm about to send it right now.
Okay, good.
It doesn't change, right? Because you just set up for streaming, so it shouldn't change anything else, I'm assuming.
I don't think so, and I don't have access to it. Maybe because you logged in first?
You don't have access to it? You should as a host.
No, but you have it, so that's all that matters. Okay.
Yeah, I sent it, but now I don't have access, so hopefully it's all good.
Okay.
I see you, so hopefully that works.
I presume at some point it's like posted to a website or something or something rather. But
Yeah.
that's the-
Okay. So once Dave replies back, I'm assuming he just means like sending that YouTube link to all the interested parties.
Yeah,
Or
yeah. Again,
everyone,
yeah.
so
I
that they-
assume that the only one would be interested in is what is whomever puts the usual link on the website on the county website. Would be
Yeah,
my
which
guess,
would-
but
which would be Create TV, but they're gone.
oh, so they actually do all that. They actually put it on the website as well.
Yeah,
that's wild.
well, for the broadcasting stuff, yeah.
Oh wow. Okay. Well,
Okay, send it to the okay. Oh, Nancy, you want me to do that or can you take care of that? I'm not sure.
If you have other things you need to get to, I can do it.
Okay,
I don't know
do
how to
have
put it
to
on the
just
portal though.
the portal, I can probably do the portal if you want to just send it to everyone in the interested parties list. The portal, I'm assuming would be, you know how we edit departments and add it on there? With that coding, I'm assuming we put it there
Oh,
whenever we
oh,
update
on the welcome page.
yes, thank you. Like the landing spot for that. I think I can do that. I'm just gonna add it right after the webinar ID. I'll do that, and if you send it to the interested parties or everyone on that Cabo list, that would be great.
Okay.
And I did click the sound option when someone joins or leaves, so you'll see when people come in. Thank you, Zach.
no problem. Thank you for being my guinea pigs for that that quick assist thing.
Yeah, no problem. Glad we can make it work. And thanks, Nancy, too.
Sure.
Fun stuff.
Oh, good. And I think I had worked out with one of my coworkers that I was going to originally be on the EOAC, but I suppose I suppose I'll just support this meeting instead.
Sounds good. I'm hoping that there's no more technical issues, so hopefully it's
Yeah.
just an easy meeting.
Yeah, me too. Okay, I am going to go grab lunch then, and I will
Great.
see you all in X amount of minutes.
Sounds good. Thank you. All right, Nancy, I think we're good. I don't know if you want to test the timer or anything.
I am sending myself the email and kind of testing it out to make sure the link works. And then I'll
Okay.
send it to everybody.
All right, and it is available on the portal, so it's already there.
All right, looks like it's working. All right.
Cool. Wasn't that complicated, thankfully. Thanks for your help.
Sure.
There's no presentations. There was like a director's report that was sent a few days ago, but everyone should be good and not needing us to present anything. So it's just check-in and timer. That's it. And the restaurant's still not working for me, so I don't know if we had a resolution with that. I don't remember.
No. We'll just have to use a Zoom recording. which is fine.
Alrighty. Thank you.
Health and Hospital Committee. Okay. Did you hear and see that?
I didn't have my screen up, but I didn't hear the timer, if that's what you did right now.
Okay, let me try it again.
Okay. Yeah, I can hear it. Looks good.
Perfect, thank you. Good afternoon, Cheryl. Would you like to do a mic check?
Yes, hi. Thank you.
Hi. Great, thank you. And Jeff, would you like to do a mic check, please? Jeff Draper, if you can hear me, would you like to do a mic check? Dr. Miller, good afternoon. Would you like to do a mic check?
Sure, I'm here. I hear you all are scattered though, right?
I'm sorry?
Oh, never mind. I hear about the power outage. Yeah, I'm here. I got you. We're
Okay,
good. Thanks so much.
Great. Thank you.
And this is Jeff. I finally got it working.
Great. We hear you loud and clear. Good afternoon, Doug. Would you like to do a mic check? I see you, but I don't hear you. Good afternoon, Renee. Would you like to do a mic check?
Hi, good afternoon.
Good afternoon. Thank you.
Good.
And Doug, have we figured out your sound? Welcome back, Doug. I do see that you have unmuted your microphone, so feel free to do a mic check when you are ready. I'm still unable to hear you. If you look at your screen on your lower left-hand side, you'll see the microphone. Next to that is a little caret. If you click on that, it'll have you select a microphone. You may want to try the different options there and see if one of those will get you working.
How about now?
Oh, I hear you,
Okay, great.
but you're a little low. Is your microphone in front of your, is there a microphone on your headset? Does it need to be
Yeah.
lowered?
Yes.
Okay. Okay, well, I hear you. That is a definite improvement from a few minutes ago.
Okay.
You just are coming across a little low, so you may just have to raise your voice a little, but we can hear you.
Okay.
Good afternoon, Michelle. Would you like to do a mic check?
Good afternoon.
Good afternoon. We hear you loud and clear. Thank you. Welcome, Dr. Cody. Would you like to do a mic check? Welcome, Yvonne. Would you like to do a mic check?
Good afternoon. Can you hear me?
Sure can. Thank you.
Thank you.
Good afternoon, Margaret. Would you like to do a mic check?
Yes, good afternoon. Can you hear me?
I sure can. Thank you.
Thank you.
Hello, Sherry. Would you like to do a mic check?
Hi, good afternoon. Can you hear me okay?
I sure can. Thank you very much.
Thanks a lot.
And Bert, would you like to do a mic check?
Sure. Can you hear me?
Sounds great. Thank you.
Thank you.
Dr. Cody, would you like to do a mic check?
Good afternoon. Can you hear me okay?
I sure can. Thank you.
Great.
Catherine, would you like to do a mic check?
Hi there. Good afternoon. This is Catherine.
Sounds great. Thank you very much.
Thank you so much.
Doug, would you like to do a mic check?
Can you hear me?
I sure can. Thank you.
Great. Thank you.
Gabby, would you like to do a mic check?
Yes, good afternoon.
Sounds great. Thank you.
Thank you.
Supervisor Lee, welcome. Would you like to do a mic check? And good afternoon, Supervisor Simidian.
Good afternoon. How do I sound?
Sounds great. Thank you.
Good afternoon. Are we loud and clear?
You are, and your clerk today is Cynthia.
All right. And do we have streaming or no?
We are streaming on YouTube, and the link has been sent to interested parties, and it's been posted on the portal. So if anyone goes to the HHC website, they will see the link that will connect them to the live broadcast.
All right. And just out of curiosity, where are you, if I may ask before?
I am home.
Okay.
And
All right.
I am also home as well, so we should be fine with connection.
Thank you very much. We will start promptly at 2 o'clock then. Thank you all.
Great, thank you. Chief Sharma, would you like to do a mic check?
Yeah. Is it working?
Oh, yes, it is. Thank you.
Thank you. Thank you.
Good afternoon, Jackie. Would you like to do a mic check?
Good afternoon.
Sounds great. Thank you. Laura, would you like to do a mic check?
Hi, can you hear me?
I can hear you. If your video is on, we cannot see you, but it does look, it does appear that it is.
It is. Give me a second. There we go.
Oh, there you are. Great, thank you.
Thanks.
And we're going to count down 3 seconds and we will begin the meeting then. All right, good afternoon, everyone. I'm County Supervisor Joe Simidian. Thank you so much for joining us. This is the Health and Hospital Committee. First item of business is to establish the presence of a quorum by asking the clerk to call the roll.
Vice Chairperson Lee,
Present.
Chairperson Simidian.
Here. That means we have a quorum present and established. Thank you very much. The meeting is called to order. I should just mention before we ask about public comment, should mention that as some of you may know, we had a power outage. PG&E informs us there's a power outage, not just in our own building, but throughout the immediate area. So members of the committee and various staff members are scattered hither, thither, and yon trying to make this work. I think it will be just fine, but please bear with us if there are some logistical challenges along the way. And thank you to all of you. We will proceed with our regularly published agenda, but again, there may be a few bumps in the road, perhaps not, but if there are, we'll manage them, I'm sure. That takes us to item number 2, which is the first opportunity for folks to comment under public comment. Public comment, item number 2, is for folks who wanted to address our committee on items not on the agenda. Again, items not on the agenda, but that are properly within the jurisdiction of this committee, Health and Hospital. So if your item is on the agenda in these other items, please hold off until we get to your item. But if you want to speak to us about something not on the agenda, properly within the jurisdiction of our committee, this is the time. Let me turn to the clerk and ask if we have anyone who has raised their hand and expressed an interest in speaking to us under public comment.
Mr. Chair, we do not have any hands raised.
All right, that takes us then to item number 3, which is to approve the consent calendar and any changes to the committee agenda. Supervisor Lee, I would gratefully entertain a motion to approve the consent calendar as contained in our published agenda, but with the understanding that we will take up item 10H. That's the report on federal health policy and budget matters, 10H, immediately after item number 4 and immediately prior to item number 5. And also with the understanding that we will take up item 11 as indicated on the agenda as close to 4 o'clock as we can, but certainly not before 4 o'clock. Could I get a motion to that effect or with some amendment of your own, Supervisor?
Yes, that's right. Agreed. And I do have one change, or actually not change. I do want to leave 15 on the consent, but I do have some comments I would like to make on item 15.
All right, then what I'm going to do is I'm going to take that as a motion with your permission. I will second that motion. Before we go to a vote, I will ask for your comment, and then I will ask the clerk if there's anybody who wants to speak on the consent calendar items. Go to it, Supervisor Lee.
Thank you, Chair Simidian. I would like to request that the Administration and Behavioral Health Board make 2 revisions to the work plan under item 15. First is to open up the attendance for MHSA Stakeholder Leadership Committee meetings to include any interested Behavioral Health Board members and consumer and a family member. As this is the joint referral between Supervisor Ellenberg and myself, declaring mental health and substance abuse as a public health crisis. Also request to have an off-agenda report on the status of the California Behavioral Health Planning Council data notebook and participants involved in putting together this data notebook. So that's the comments I have for item 15, but other than that, I'm ready to vote. Thank you.
Thank you very much. And before we actually get comment from members of the public and then go to a vote, let me just ask either Dr. Smith or Ms. Terrell if there's any difficulty with the 2 requests that were made by Supervisor Lee.
Good afternoon, Chair Simidian and Supervisor Lee, Sherry Terrell, Director with Behavioral Health. I think we should be fine with responding to those 2 requests.
All right. Well, then we have a motion and a second, and staff seems to indicate that that's all manageable. Let me turn to the clerk, see if we have anybody from the public who would like to speak on item number 3, consent calendar. Madam Clerk.
We do not have public comment.
All right, then we'll call the roll, please.
Vice Chairperson Lee.
Aye.
And Chairperson Simidian.
Aye. Motion carries unanimously, and consent calendar items are approved, as is the revised agenda order. That does take us to item number 4, and this, of course, is the regularly scheduled monthly opportunity for us to approve appointments and reappointments and privileges of various staff, and also to approve new physician assistant, enterprise-wide privileges for the Department of Surgery. All of this is contained in our packets as item number 4. And let me turn and see if Dr. Kranis is with us. I believe she is. Dr. Kranis, welcome.
Good afternoon, Supervisor Simidian and Supervisor Lee. I'm here to present the credentials report and also the enterprise privileges for physicians, assistants in surgery, and answer any questions.
All right. Supervisor Lee, any questions, or would you like to offer a motion to approve?
No questions. So moved.
All right. Motion to approve item number 4. I'm happy to second. Dr. Kranis has no additional comments in the absence of questions. If you do, please lean in, Dr. Kranis. Let me just double check with the clerk. Any members of the public who would like to speak on item number 4?
We do not have public comment.
Thank you. Then we'll call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye. Motion is approved unanimously. Thank you, Dr. Kranis. Thank you, Dr.
Thank
Lee. And we'll see you next month, I'm sure. Take care.
Thank you. You too.
That then takes us to item 10H on our revised calendar. And I believe we are joined by Mr. Margolin for this item. Mr. Margolin, I see you nodding and smiling. Thank you. What would you like to share with us? And full disclosure, Supervisor Lee, I did ask Doctor, I did ask Mr. Margolin to share some information with us about Medicare Advantage and other issues in that same general area. So, Mr. Margolin, go to it.
All right. Thank you very much, Supervisor Simidian. Let me start with the Medicare Advantage issue that you asked me to briefly discuss. The simplest way to describe Medicare Advantage is that it is a managed care option for Medicare beneficiaries, which utilizes private health plans to organize the care. So it's a voluntary choice for a Medicare beneficiary. What's the incentive for someone on Medicare to choose Medicare Advantage? Well, first of all, they get coordinated care, a care coordination function that fee-for-service does not typically provide. Someone's looking out for their overall health and the coordination of specialists and primary care. And they also get enhanced benefits. It varies by Medicare Advantage plan, but they typically include things like dental, hearing, vision, things that are not available in fee-for-service. Various Medicare Advantage plans offer them as an inducement to get people to enroll. The private plans that participate are paid a capitated rate. That's a per member per month rate for the most part. And their incentive, of course, is to keep, in theory, this is the theory at least, the population as healthy as possible, because if they keep the population healthy, costs are lower, the plan can retain more of the funds. Medicare Advantage has become enormously popular. It's currently nationally about 1/3 of the Medicare population enrolled in Medicare Advantage. The projection is that will increase to about 50% of the national Medicare population by the end of the decade. And here in Santa Clara County, we're already close to 50%. The last survey I saw in 2020 had the Medicare Advantage enrollment at about 46% here in Santa Clara County. Now, Medicare Advantage also has drawbacks and a group of critics, people who are skeptical about aspects of it. The first point that's often made is that if you're in a Medicare Advantage plan, there's a limitation on your choice of providers. If you live in a community with a robust panel of providers, that may not be an issue, but in certain parts of the country, in certain regions, the limitation on providers could be an issue, especially if you have a serious illness and want to see a particular kind of specialist. Hopefully your plan has access to that, but when you're in managed care, that can be an issue. The other issue, and this is one that crops up whenever managed care is discussed, is the inappropriate denial of care. So while I said that the theory is you get a per member per month payment, keep people healthy, as a plan, you make more money. Of course, you can make more money by keeping people healthy. You could also, and this is not ethical, but it's an issue that occasionally arises, you can also make more money by denying care, by saying you don't need that test or that specialist consultation. A 2018 Federal Health and Human Services study by the Inspector General said that inappropriate denial of care was a, quote, widespread and persistent problem, unquote, in Medicare Advantage. Again, there have been efforts since then to deal with that issue. But it is an issue that some people point to. Another issue, and this is in part philosophical and in part practical, but another problem that many people have with Medicare Advantage is it's a movement away from Medicare as a government-run program. In Medicare Advantage, you're turning this over to private health plans. And if you support Medicare for all, which again, there's a broad base of people who do support that concept, that program, the meaning of that means government-run healthcare, nationally organized. And Medicare Advantage is a movement away from the government control of the Medicare program, and it makes Medicare for all a more challenging concept to promote in future years. So Medicare for all, those are some of the pros and cons. Let me just very briefly touch, if you don't mind, Mr. Chair, on the ACO concept, which you also asked me to talk about. This gets a little confusing, but I'll try to simplify it. There's another way to access Medicare services beyond Medicare Advantage, and that's through something called an Accountable Care Organization, an ACO. An ACO is an agreement among a group of providers, doctors, hospitals, typically, to coordinate amongst themselves to provide care to Medicare beneficiaries. So the key distinction here between Medicare Advantage and an ACO, there are exceptions to this, but in general, the Medicare Advantage approach is a plan-driven. The ACO is provider-driven. And another key distinction is that in an ACO, you're not locked in this as a patient in the same way. Your provider makes the choice to coordinate with other providers and to share savings and to provide for better organized care. But if you as an individual patient of that provider say, hey, I don't want to be part of this ACO, you simply tell your provider that you don't want your information shared with other providers, or you find a different provider, as opposed to Medicare Advantage, where you're locked in, at least for a period of time. The Biden administration, my final comment here, Mr. Chair, on this is that the Biden administration has advanced a new form of ACO called ACO REACH, which is an acronym for Realizing Equity, Access, and Community Health. And there's some controversy about ACO REACH because it takes this whole concept of allowing private providers to make a profit out of Medicare to a new level. But the Biden administration philosophy and theory behind this is that it's designed to really pursue health equity objectives through Medicare. And the way that works, just in simple terms, is in ACO REACH. If you become a provider in that system, you'll get a capitation payment. You'll get an extra large payment if you pursue health equity goals, if you have an unusually high proportion of traditionally underserved patients in your system, you'll get a monthly increase. They also are focused on social determinants of health, something that Cal Aim and Governor Newsom are very focused on, and Santa Clara County is very focused on. And CMS wants to collect data on social determinants. And if a provider in ACO REACH collects the data on the social conditions that impact their patient and allows CMS to have that data, CMS will increase that provider's monthly payments. So again, it's financial incentives to pursue this health equity, social determinants of health series of goals. Critics of ACO REACH have some of the same concerns as critics of Medicare Advantage. Again, there's a school of thought that this is moving Medicare away from the government-run model that most people thought it was, and certainly it has been historically, to a system that empowers plans, private for-profit health plans and private for-profit providers to have more control over the delivery of care to patients. That's sort of the critique. And before I get to the federal landscape portion of my report, I'll stop there and see if you or Supervisor Lee have any questions.
I have just one or two, but let me turn first to Supervisor Lee.
No, I don't. Thank you.
Thank you. Mr. Margolin, a pair of interrelated issues that has been raised with me is that there's apparently some question about whether or not there's apparently some concern about the fact that folks who choose Medicare Advantage are then locked in, that this is an irrevocable decision, and that then the related concern is that not altogether clear that people understand that, or the other implications of the on the one hand, on the other hand, that you just so ably provided us. Thoughts about those two issues, if you have them?
Sure, I do have thoughts. I did some research on that specific issue, and it turns out that it is not actually a revocable decision. There's one aspect of it that's very problematic, can be problematic for people who have a serious illness, and I'll talk about that in a moment. But you actually have the ability twice a year to make a change. You certainly can change your Medicare Advantage plan twice a year during these open enrollment periods. That's double the amount of opportunity that you have in traditional Medicare. You have an open enrollment period once a year to make your Medicare choice. In Medicare Advantage, you've got a second window to make a choice and to change plans. So you do have the option of changing Medicare Advantage plans, and you do have the option of leaving Medicare Advantage and going back to traditional Medicare. The problem that I think some people have raised is when you do that, if you do that because you have a serious illness, there's a pre-existing condition glitch in the law, as best I can tell, that under federal law allows the Medicare gap coverage plans that typically people get when they have serious illnesses. That you want to have standard Medicare, and then you want to have your Medigap coverage as well for extra costs. The Medigap plans have the ability to say no to you if you are leaving Medicare Advantage and you have a serious illness. In other words, a pre-existing condition for a period of time. I think it's 6 months. That's what my research showed. And somebody who's unhappy with their Medicare Advantage, they've gotten very sick. They don't like the provider options available to them. They need specialists who are out, and they want to get out of Medicare Advantage back to traditional Medicare. They apparently have a restriction for a period of time on getting the Medigap coverage that they would like. And that's the issue that I think some people have recently raised. It's not that you're locked in irrevocably indefinitely. You can get out of it. But if you have an illness, there are barriers and burdens that some people are unhappy about.
And Mr. Margolin, you described it as a glitch. Did your research indicate whether anyone is attempting to address this glitch, or whether it looks like that's an accepted feature? It's not a bug, it's a feature at this point.
Well, it appears I haven't come across an effort to change the policy, but I certainly will. I can do further research to see if there's any interest at the federal level in doing that. It appears to be, for reasons that I don't fully understand yet, a feature that they allow for this pre-existing condition limitation, this discrimination, which again, in the ACA and in general health insurance, you can't deny people coverage based upon a pre-existing condition. So the fact that you can do it with the Medigap coverage seems odd to me, and I will do additional research on that issue.
Thank you. I would appreciate that, and we'll follow up with you next time we meet, and I'll just ask you then what additional information, if any, you've been able to uncover, okay?
That's fine.
Then for the rest of your health policy and budget landscape, since we have you, what would you like to share?
Few points to raise. First of all, the COVID supplemental, the effort by the Biden administration to get additional funding for the purchase of vaccines and tests. It's currently at about the $10 billion level nationally. It's still stuck. It got knocked out of the omnibus appropriation bill because there was a rebellion by some House Democrats over how it was being paid for. It's now stuck in the Senate over a combination of factors. You have budget hawks who, on the Republican side particularly, who say there's unspent state money for this purpose. Why are we giving more federal money? And you also have this Title 42 fight. This is the public health emergency reg that the Trump administration adopted to turn away migrants at the border using COVID as the rationale. The Biden administration wants to get rid of Title 42. Senate Republicans and some Senate Democrats say we don't want that to happen, and they want to attach a Title 42 extension to anything that involves COVID funding. So that's created an impasse, a combination of budget hawks and Title 42. I think at some point, and Dr. Cody will have more insight on this issue if you wanted to ask her, at some point there's likely to be a break in the logjam. Unfortunately, it may not come until we're in another state of crisis. Again, the Biden administration was trying to get the money freed up prior to the next crisis so that it would be in the pipeline, but the Senate isn't responding the way we would have hoped. Next update is on Build Back Better. I keep on talking about it, even though there's a conventional wisdom that it's dead. I've argued and I continue to believe that it's not completely dead yet. There are discussions going on between Senator Manchin and Senator Schumer's staff. A smaller package would involve drug price reform, climate change investments, and importantly for us in California, a continuation of the ACA premium subsidies that have made Affordable Care Act coverage much more affordable. There should be a deal at some point, I would think, but we're getting short on time, and there's a chance it won't happen, unfortunately. Public health emergency is the other issue. It's been extended through mid-July, and it's going to be extended again, we believe, into the fall. There are a number of flexibilities involving telehealth, new federal money for California that are tied up in the public health emergency. Governor Newsom's May revise actually addressed that issue by saying that if we don't get the public health emergency extended past a certain point, I have what he refers to as an unwinding plan to deal with a whole series of state issues to make sure that issues like telehealth and others are handled in an appropriate manner. There's also one other issue in the governor's budget worth noting, to be my last comment, and that is I talked about the ACA premium subsidies, the need to fund them through the Build Back Better plan. If that doesn't happen, they expire at the end of this year. They were only approved for 2 years. The Newsom administration prior to this had their own subsidy program to bring down the cost of healthcare. And Governor Newsom has put $300 million in the May revise to restore the California-only ACA subsidy program to bring down costs if the federal government fails to act this year. That's just worth noting, and that completes my update.
Thank you. And just to ensure that I got it all on the premium subsidies, the premium subsidies that you have talked with us about previously remain in place. They are federally funded, but they are set to expire absent some legislative action. Is that the state of play?
That is correct.
Do you happen to recall what the annual cost of those premium subsidies is, or how much money is at issue in the look ahead?
In terms of the packet, the federal package, I don't remember the exact number. It's in the hundreds of billions of dollars.
Hundreds of
billions of dollars over multiple years. Multiple years, but I don't. I can get you the number if you'd like that.
If you could just share with us off agenda the cost of the premium subsidies. And Mr. Margolin, as always, feel free to correct me if my either articulation or memory is incorrect. But I seem to recall that, even folks who were relatively supportive of the Affordable Care Act were initially concerned that while coverage was guaranteed, and the many features of up to 26, you can be on the family's plan, and pre-existing conditions were addressed. There was initially concern that what the Affordable Care Act had not done as much as some had hoped was drive the cost down. And then the premium subsidies, of course, address the cost, not by driving the cost of service down as much as by simply subsidizing the rates. Am I remembering all this correctly?
You are.
Thank you. Then I would appreciate knowing, all right, looking ahead, the continuation of those subsidies will cost how much money over how many years? That
I can get that number to you.
Thank you very much. Let me thank Supervisor Lee for his patience. Turn to him and see if he has questions or comments.
Yeah, thank you, Mr. Margolin. So you mentioned there are a few things that might still happen for the modified Build Back Better type of ideas. One idea that was discussed quite a bit previously regarding the 2-year of preschool being covered by the federal government, is that issue pretty dead?
It seems to be because of costs. So the three items I mentioned, drug price reform, climate change investment, continuation of ACA subsidies, eat up most of the available money in a slimmed down package. On top of which Senator Manchin is actually talking about tax cuts that will be added, that will help reduce the federal deficit. He'd rather spend remaining dollars on deficit reduction. That's the current tenor of the talks. So the 2-year pre-K piece seems to be off the table now. I say seems to be. These discussions are all closed door, and there's nothing been released publicly.
That certainly is disappointing, but thank you for the update.
Sure.
And thank you, Mr. Margolin and Supervisor Lee. I can't resist trying to assuage your concern somewhat by the fact that the transitional kindergarten program that I initiated now a decade ago is going to be available not just to a quarter of our state population for those young 5s, 4-year-olds, but for the entire population as a result of action by the state. So I know that's not all that we might have hoped for, and certainly not the help we were hoping for from the federal government, but it gives me some comfort that we are at least stepping up here in California, as we've discussed before. Let me check with the clerk, see if we have anyone who wanted to speak on item 10H specifically.
There are no hands raised.
Thank you very much. Appreciate you taking a moment to scan the environment. Then, Mr. Margolin, anything else before we say thank you and let you sit back and relax and enjoy the rest of the meeting with us?
Nothing else on my end. Thank you.
All right. Thank you very much, and appreciate your willingness and ability to follow up on the issues that we have raised. All right. We will, Supervisor Lee, I'll ask for a motion to consider 10H received when we get to the end of the agenda. And for those who are wondering why we're not taking separate action on that item. That does take us to item number 5, which is to receive the report from Fleets and Facilities regarding our Child and Adolescent Psychiatric Facility, Behavioral Health Services Center. Who's going to present on that one?
Good afternoon, Supervisors Midian, Supervisor Lee, Doug Koenig, Deputy Director of Capital Programs. As an update to the report in your packet and referring to the new graphic that we've added, I would report that we did not receive approval from HCI for increment 3, which is the interior improvements on 515 as was projected. Though the design team has responded to the vast majority of comments received, HCI continues to issue new comments. However, we would not expect that this would result in any delay of the overall project. The contract.
Excuse me, Mr. Koenig, I apologize for the interruption. I just want to make sure I'm tracking you. And the reason that would not occasion a further delay is because by getting approvals incrementally, we do already have approval for what I'll call the main construction effort, the initial construction effort. Yes?
Correct.
Thank you.
We've got the approval for the foundation, the structural steel. Certainly by the time they would need the approval for interior improvements, we would have that and it would not delay the schedule.
Thank you. Please continue. Sorry for the interruption.
Okay, as far as we did award yesterday, the contract for the demolition of parking structure number 3, as well as the excavation for the new building as projected. The solicitation process for the replacement parking structure and the demolition of the Delaware Majority building is on track. And we would expect to get our bids on June 2nd as scheduled and bring it back to the board on June 28th for approval. The solicitation for the main building, as you know, has been delayed due to the fact that our 3 pre-qualified bidders notified us that they would not be submitting a bid. As soon as we learned of that, we sought and received approval from the board yesterday to open up the invitation to bid to all bidders. But unfortunately, because of that, we'll likely lose 2 months from our projected target date for award, which was June 28th. That concludes my comments. Are there any questions?
Yes, before I turn to Supervisor Lee, let me just ask, any sense of what prompted the, I guess that's a backwards question. Any sense of why we didn't get bids from the 3 pre-qualified bidders?
Their main concern was if they had to go out and bid a hard bid, they are having extreme difficulty getting their subcontractors to commit or to honor their bid for any length of time. And if due to the extreme price fluctuations that we're experiencing right now, the problems with the supply chain and all, they don't want to commit to a hard number and a hard schedule up front.
And I did understand you, however, to indicate that you have a successful bid on the demolition of the existing parking structure, the removal of which is a precondition to building something on the site. Did I get that right?
Yes, that's correct.
And timing on actually knocking down the existing structure looks like what? Do we know yet?
I don't have the schedule yet from the contractor. I would expect that would be 60 days or so.
Right. Could I ask that that information be shared with our offices at the earliest opportunity so that we know well ahead of time what the schedule is? Given the delays, and I'm going to be very candid here, I think I am anxious to see various actions taken which make it plain that we're on a committed path to get this done. Obviously, one of those was the financing. I'm glad that that's squared away. One of those is the approvals from the organization formerly known as OSHPD. And yet another one of those would be knocking down the structure that needs to be removed in order to make place. So I'm looking for any milestone I can find that makes it more and more clear that we are committed to getting this thing done on whatever timeline ultimately is necessary. Okay?
Yes. Yes.
All right. Supervisor Lee, comments or questions on this item? This is simply to receive the report as we've discussed.
Yes, I certainly share your concern that you have asked these questions when our 3 pre-qualified contractors, that none of them is willing to bid, which really is concerning because of the deadline that we're trying to make this happen. Is there a way we could break down our RFP so that some of these risks would not be so difficult for them? Because obviously things fluctuate in terms of cost. We all understand that with a very inflationary period that we are dealing with here. I'm just trying to find ways to make sure that this project does not get further delayed as much as Chair Submidian has voiced. I'm just as concerned regarding how can we break into smaller pieces in RFP to make this more acceptable to the potential bidders, or what other ways can we do it so that we're not going to keep going back and forth on this?
Supervisor Lee, Supervisor Submidian, this is Jeff Draper. We have a couple of ideas, but we have to run them by the county exec's office. I don't know if there's a true way under the normal public contracts low bid approach that we have to use that we can effectively do it, but we're looking at some cost escalation mitigation strategies, some language that we could put in the contract to see if that will help get us through it. But we haven't made a decision yet. It's just we've known that there's a couple of other agencies that have looked at using that type of language. So we'll explore it with county council and county exec, and we're happy to get back to you offline on that.
Yeah, please. I think that would be very helpful because if that type of escalation is being taken into account, I think the bidder would realize that they are not going to be holding the bag if the cost is significantly higher than what we're anticipating here, which of course nobody has a crystal ball, and we get that, number one. I just want to have a quick comment is that whatever we do, let's not do what we call a cost plus type of a contract, cost type of percentage of a guaranteed profit. I dealt with that in Iraq for a year, and it's the most ridiculous way of running any contract. So I just want to make sure that we're not going there in that sense. But as far as the any type of escalation of cost, whether we could, help mitigate those issues on the risk to make the contractors dealing with that, I think that's only fair. Thank you very much.
Thank you. Any other questions or comments, Supervisor Lee, or can I get a motion to receive the report?
No, I'm good. Yes, let's do. I'll have a motion to approve. Thank you.
All right, we have a motion from Lee, and I'm going to indicate we have a request for a report back on alternative bidding practices as indicated in Supervisor Lee's questions and comments. I will second the motion. Before we call the roll, let me check with the clerk, see if we have anybody from the public who'd like to speak on this item.
We do not have public comment.
All right, then we'll call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye, motion carries. The report is received and the direction is provided as indicated. That takes us to item number 6 on our agenda. Item number 6, of course, is to receive the report from the public health officer relating to vaccines and COVID-19. And Dr. Cody, do we have you with us today?
Yes, I am here. Good afternoon, supervisors. So I'll
Thank
just
you.
give you a. Do you have a question?
I just wanted to say your choice as to whether or not you take a follow-up question on monkeypox at this point or later in the agenda under item 10 when we receive the broader report from public health officer. Want to manage everybody's time as best we can. Go right ahead, Doc.
Sure. Happy to cover both COVID and monkeypox. So, as you know, we are in what I'm calling our 6th wave here in Santa Clara County, and all indicators of our community transmission tell us that rates are rising, continue to rise. The models suggest that they are going to continue to rise probably into early to mid-June before they level off in fall. And they are still driven by subvariants, BA2 and BA2 subvariants, which spread even more easily than previous variants. This is starting to translate into a bump in hospitalizations, not like we were seeing with Omicron, but nevertheless, it's been a slow rise over the month of May, and the pace is beginning to pick up a little bit. I think that sort of stepping back big picture, what we're seeing is we have extraordinarily high vaccination and booster rates in our county and in this region. And so even though the current circulating strains have really evolved since the vaccines were developed for that original Wuhan strain, they nevertheless are still quite effective at preventing severe illness, hospitalization, and death. So we're just seeing something we've not seen previously in the pandemic, where we've got a lot of community transmission. I know everyone knows someone who has recently become ill, if not themselves, and yet our hospitals are doing reasonably well. So an update on where we are with the vaccination. As you likely know, boosters are now available for everyone 5 and up. So those 5 to 11-year-olds now have the opportunity to get boosted, and at our county sites, we started giving them within an hour of when they were approved. And the other news regarding boosters is for second boosters. CDC now recommends second boosters for everyone 50 and up. So not the may have, could be available to you kind of language, but we recommend it if you're 50 and up, get a second booster. And of course, they're also recommended for anyone 12 and up who is moderately or severely immunocompromised. So the last group to have vaccines available to them, of course, is the under 5s. That's in process. Looks like it'll be 3 doses and hopefully underway sometime this summer. So happy to take your questions on COVID and your question on monkeypox.
Thank you. Supervisor Lee?
Yes, thank you, Dr. Cody, on that issue regarding this sixth swell or wave or whatever you want to call it. And I think I share with you, like so many people, saying that there's somebody close to us that has been infected fairly recently in the last couple of weeks. But I also share that the incident does not result into folks, and most of the people I know, or actually everybody I know I talk to, that seems to have actually been vaccinated or even boosted as well. So but at the same time, I think just like you said, does not rise to something very, very serious, but again, to any hospitalization and whatnot. But one thing that I've been hearing, though, I don't know if you've heard of that as well, is that the time period is a bit longer. Somehow I was hearing that was like about 5 days or so previously from the anecdotal evidence I've been hearing. It seems like this sixth well or this new variant, the amount of time to recover tends to be longer. Did you hear anything like that at all in your end?
I haven't, to be honest. So I don't know. I don't have an answer to that.
Okay, thank you. I just wanted to check on that. Now, we know about those two variants, Omicron. Any other type of new variants that you're hearing at all?
So the B2 has a number of different subvariants. One of those, and I think we talked about this in the last board meeting, it's a longer name, B2.12.1, which spreads even more easily than B2. There are a number of other B2 subvariants. And interestingly, the pattern in California is different than the Northeast, where this subvariant of B2 really dominated, had a tremendous growth advantage, and kind of crowded out everything else. In California, that variant is growing, but it hasn't yet crowded out all the B2 nor the other B2 subvariants. So we have a little bit more of a mix. I think what we can expect is that more, different variants will emerge, and those that have an advantage, a growth advantage, we'll see more of, and then the others will fade away.
Right, correct. And at this point, in terms of the guidance, if you could remind us, what's the latest guidance regarding the mask wearing? Because I know there were back and forth in terms of when you can wear it, where you're not. What's the latest guidance from the county right now regarding mask wearing in indoor and on public transit and all that?
Yes. So in Santa Clara County, once the mask requirement was lifted, we nevertheless recommended masking indoors. We strongly recommend masking indoors. We urge masking indoors, and that's because the level of community transmission is quite high, and we know that even if you're vaccinated and boosted, it doesn't protect you against infection. It reduces your chance of being protected, but it doesn't eliminate it. And so you need that other layer. You need to mask when you're indoors. We also, if possible, advise folks of going to really crowded indoor gatherings, particularly if the ventilation is poor. So the advice is take the gathering outside if possible. And if you're indoors, make sure everyone is masked. The masks and with the masking recommendation comes to choose the highest quality mask that you can. So a N95, KN95, or KF94.
Thank you. And right now, in terms of public transportation, like the VTA or BARD and buses, currently there's no mask mandate, but only a strongly recommended, correct?
I believe that BART has a mask mandate, and I want to make sure it's understood that each of those transportation agencies can issue a masking requirement for their staff and travelers. It does not have to be a health officer mandate. They can issue a mandate, and in fact, because transit agencies travel between different counties, it it makes sense, rather than in Santa Clara County, you have to put your mask on, and then once you transit through San Mateo, you can take it off, and then you re-enter San Francisco and you have to put it back on, right? But an agency can issue a mask requirement. But my understanding is that just BART has done that.
Great. Thank you, Dr. Godey. As you know, there's been so many different mandates and rules and from different agencies, whatnot. So I think from the public's point of view, it's very confusing. And I'm glad that you are able to help clarify at least what the latest rules are. Thank you very much. And that's all.
Yeah, and I guess I would like to add one thing to that, which is in schools, similarly, the state had a requirement for masking in schools that lifted. And in absence of the state's requirement, then it's up to each individual school superintendent to decide whether to require masking for the schools in the district. And I know that, for example, Berkeley Unified School District now requires masks. I think there's a handful of others. Most don't. But I of course would like to see more consistent masking in schools, up to and including a requirement if that's what's needed based on what the superintendent observes.
Thank
Yeah,
you, Dr. Thank you, Dr. Cody. Other questions or comments, Supervisor Lee?
No, not at all. And I do want to say that thank you, Dr. Cody, for that clarification, and that from my own observation of my kids in school, elementary school, high schools, seems like the kids are still very much very good at wearing the mask at school, knowing the risk involved. But thank you very much.
Thank you. And Dr. Cody, as I indicated earlier, I did want to ask if we could hear from you about the presence of monkeypox and the level of concern that you think that should generate. We've been reading it seems a bit more and more in the press about the matter. What would you like to share with us on that subject today?
Sure, I'll just give you a couple top line messages and then a little bit of background. So the first important thing to know is that the overall risk to the public from monkeypox is low. So it is not something that the public needs to put on their worry list. Put it in the back. So that's important thing number one. Based on what we know about it now, it's not easily spread. And at this time, we've not seen any cases of monkeypox suspected, probable, or confirmed in Santa Clara County. So the background for what's going on is that monkeypox has been endemic in Central and West Africa for a long time. But what's happening now that's different is there's more than 100 cases across a dozen countries, mostly in Europe and Canada. And as of yesterday, there was at least one confirmed case, 8 probables in the US, and one of those probable cases was in Sacramento County. So I think that's what sort of brought it closer, feels closer to home. So I can tell you more, happy to stop there and answer any follow-up questions.
Could you talk a little bit about how monkeypox is transmitted and why your assessment is that the risk to the general public is low, please?
Sure. So it's caused by a virus, and it is spread by the respiratory route, mostly large droplets. It's also the pustules or the rash that develops with monkeypox is infectious. So if you're, in skin-to-skin contact with someone's rash or with their bedding or clothes or something that might be contaminated. But the patterns that, historically in how monkeypox spreads, it's not something that just, rips through a community. It's mostly someone who's, been in close contact with somebody else. So that's why the comment. And that's the assessment that the CDC has made and the state has made based on what they know is that the risk is low.
All right. Thank you. Let me turn now to the clerk and see if we have any members of the public who'd like to speak to this issue.
We do not.
All right. Then I'll say thank you, Dr. Cody. Supervisor Lee, can I get a motion to receive the report?
Yes, so moved.
And I will second. And Supervisor Lee, just want to confirm we will consider that also inclusive of 10B, which is the regularly scheduled oral report from the public health officer. Yes?
That's correct. Thank you.
Thank you. Motion and a second. Call the roll, please.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye. Motion carries unanimously. Thank you again, Dr. Cody, to you and your team. That takes us to item number 7, which is to receive a report from Santa Clara Valley Medical Center and the Facilities and Fleet folks regarding efforts to establish 2 new health centers, one in the North County and one in the West Valley area. Who would like to share what?
This is Jeff Draper, Supervisor Simidian.
Thank you.
I'll start off, and I think Paul's on the line if we need his support. On the North County Clinic at the site of 4151 Middlefield, we're engaged pretty deeply in trying to get to the terms of the lease. This also includes the tenant improvements that'll be necessary to convert the facility to a clinic. It's not currently a clinic, it's an office building. And so there's quite a bit of work to determine the scope and the cost related to that, so we can bring a full lease to the board for approval. But work is proceeding feverishly, and the landlord is motivated. So I expect to get something before the board relatively soon. But it'll be after midsummer, probably in the August timeframe is kind of what we're targeting at this point.
All right.
And I can move on to the West Valley one if you would like.
Please.
The West Valley, we've had an initial engagement with the leadership at the community college district. The next steps, as listed in the report, is basically to formulate a list of services that we would provide and to go back to the college district with a letter of interest and then help let them work that through their process to see the next steps on their end.
All right. I believe we're expecting a report back on the West Valley site at the full board at our first meeting in June. Am I remembering that correctly, Mr. Draper?
Ooh, possibly. I guess I better get some paperwork going.
All right. Well, I guess what I would say is I'm prepared to accept a relatively thin report today on the West Valley effort, but I'm hoping that when you next report either to the board or to the committee, that we have appreciably more. All right. So please consider that a formal request by me, and I'm going to ask the Supervisor Lee in a minute for a motion that incorporates that request quite specifically and quite formally. Supervisor Lee, do you have comments or questions? I have a related matter, but I want to stay on task here before I broaden the conversation a bit.
Yes, the only thing I just want to know, Mr. Draper, do you see when you could provide us the timeline like you did for the other items for both of the VHCs for both North County and West Valley, something more comprehensive so we could have a better estimate of the future dates?
Yeah, Supervisor, happy to provide a timeline. I think as we get toward as we get into June, we'll be able to provide a preliminary schedule, certainly on the North Health Center up along Middlefield. I think the one over on De Anza maybe take a little bit longer because we have to propose services. The state has to consider what they have as an alternative, whether it's a new build or it's an existing space. And we have to kind of work through the project scope before we could give you a reasonable timeline, if that makes sense.
Okay, thanks.
I'm not sure if Dr. Smith is on the call or if Mr. Marquez is the leading today. Mr. Marquez, I know there were 2 sites in the North County that were under consideration for a North County clinic. I wonder if there's any potential with that second site to address the fact that the North County Social Services Office, the only one in the district, is apparently running out of time on its lease, which I'm told expires at the end of 2023. Is that an issue you've been engaged in or on, or you or Mr. Draper?
The lease expires on September of 2023. The knowledge that they wanted to develop it is relatively new to me, but we know about it now, and I've certainly informed the county exec's office that that's a concern.
Yeah, that it just been a great, I learned about that, I think last week or maybe earlier this week from Mr. Draper. So we're aware of those dynamics and are starting to look into it, and we'll incorporate it into our thinking for sure.
Yeah, I'm stretching the item only a little bit here because my experience with county efforts to identify real estate in the North County is that county staff is always taken aback by both the cost and the length of time it takes to identify and negotiate a site. So while September of 2023 sounds like a long way off, I am nervous already about the potential loss of service for folks in the 5th Supervisorial District who, as I say, have no other social services agency office in anywhere in the district, to the best of my understanding, in terms of our service delivery model. So I just want to encourage you all to be thinking, and I know this is, pulling SSA in, but be thinking about whether or not there's, some opportunity for blending the two uses at one or the other of the two buildings you've been looking at, or if all of the site that you're focused on for North County Clinic is in fact devoted to North County Clinic, whether the other site you were looking at might not be an alternative for SSA. I don't happen to recall how much space SSA has in their current location, but as I say, I'm very concerned about the potential loss. This has been a struggle for 25 years, Mr. Marquez, Mr. Draper, to keep these services in the North County, and I think you can expect to hear from me on this until we have some certainty about what our plan is to have a smooth transition that leaves services in place for people who so dearly need them. Okay. Mr. Supervisor Lee, I think we have a motion from you, yes, to receive the reports.
That's correct. Thank you.
And I have seconded with the understanding that the motion incorporates clear direction that the next time we hear a report on this, whether it's at the full board, which I believe is scheduled for June, or at this committee, that we get a substantially more robust report about progress at the West Valley Dianza site. And Mr. Draper, one last question, if I may, before we call for the roll here. Do I understand that the North County lease has an option to purchase in it at some point?
It does.
And do I understand correctly that instead of this coming to us in June, negotiations now require that it come to us in August? Yes?
That's correct. We have to get through the full scoping of the project, if you will.
Okay. Then I'll ask Clerk one last time. Any comments from members of the public on this item?
There are no public comments.
All right, then we'll call the roll.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. All right, that motion carries unanimously with the direction as indicated, and that completes item number 7. That takes us to item number 8, an important item, and unfortunately, Supervisor Lee, I have to step away for just a moment. So, Ms. Lowther, let me just suggest that we take a break until 3:10, because I don't want to leave you with just one supervisor. I know you'd be in capable hands with Supervisor Lee, but I know how important this issue is, and I know you'll want both supervisors. So Supervisor Lee, without objection, we'll take a 10-minute break, and we'll get back to this item at 3:10 sharp. Apologies to the clerk for the last-minute nature of the announcement. Thank you. Take care.
Thank you.
All right. We are at 3:10 yet again, calling the meeting to order, and I'll ask the clerk to call the roll once again, just to establish the presence of a quorum as a matter of public record.
Vice Chairperson Lee
Here.
and Chairperson Simidian.
Here, thank you all for that accommodation. And Ms. Lowther, you have our undivided attention, not one, but two, both members of the committee.
Thank you, and good afternoon, Supervisor Simidian and Supervisor Lee. Thank you for allowing the EMS agency to give you a brief update on EMS 2024. Almost 3 years ago, in June of 2019, the EMS agency convened an introductory meeting with key stakeholders from law, fire, hospitals, the EMS agency, county council, procurement, county communications, city managers, and county leadership to explore and define the options and structure of the EMS system in Santa Clara County after the current 911 EMS ambulance transport agreement ends in 2024. We had 5 meetings, and then unprecedented events of COVID-19 sort of superseded the group from continuing to meet on a regular basis and sort of stopped. We finally were able to reconvene this group, the same group for the most part. We had a couple of people replace other members. April 19th in 2021. At that time, the decision to seek an informal competitive procurement process for a consultant to help us facilitate the stakeholder group for the meetings, as we, the EMS agency, is also a stakeholder to help us navigate and one as well, to help us navigate the financial portion of a future RFP was made. The search began and took a little while. The first informal competitive procurement was completed for the facilitator of the group, October of 2021. Meetings commenced. They sort of did a survey of all the members to seek and see what their interests were and where they were at. And this consultant was used to provide assistance with organizing, facilitating the meetings, and collecting and disseminating information for our ambulance area. They have commenced, and we have been looking at different models, including a third city service. We looked at, that was the one from Austin, Texas, the private model, which was ours here in Santa Clara County, public-private, as well as a fire model, which we will be having this Friday, as well as the best practices. What we hope to give you all is a much more comprehensive report in the fall after the financial analysis has been completed. That is just going underway, as that ICP has just been completed, and the stakeholder group has had the opportunity to really evaluate sort of all models comparatively and synthesize all that information, which is a great deal, looking at the financial aspects of it, as well as all these various models, because Contra Costa, which is the public-private model to our north or close to us, and our timeline is to have an RFP completed and ready by February of 2023 in order to be in conformance with EMSA, which is our state regulatory body. After looking at the report, are there specific questions that you or my colleague, Dr. Miller, could answer?
Let me check with Supervisor Lee. Supervisor Lee, questions, comments?
Yes, thank you. The report actually does state that the RFP issuance is critical priority and it's time sensitive and high value, but it won't be done till I think it says February 23, which is kind of late. Any possibility of getting that moves faster?
Getting it to us, I'm sorry, sir.
Yeah, anything
Faster.
Yes. Yes.
Faster. What we anticipate is trying to get all the information and the scope of work done in the October timeframe. So it very well may be done by the end of the year. Any new prospective bidders have to have at least a year. And by our timeline, this actually works out just about right to give any prospective bidders time to actually bid and go through the entire RFP process. And they must have a year in order to, if it is a bidder that is currently not within the county, time to acquire ambulances and get the entire process rolling. So we're working as fast as we can to get all the input we can to stay as neutral as we can. That's why we removed ourselves from this entire kind of, we want all the input that we can from our stakeholders, but we will try to get it out between, I would say, November and the end of the year. We targeted February because we knew that that was a feasible date to get it out, but we will get it out as soon as possible. And we would like to return to you probably in October, November at the latest with a comprehensive report.
Okay, thank you. That's all I have.
Thank you. Ms. Lowther, uncharacteristically, I'm going to hold off on questions only because I'm waiting for the more robust report that you identified as being associated with the RFP process.
Okay.
I know you and Dr. Miller both have heard me in past about the kinds of issues and concerns that I raise, and I know you know that I think this is an important contract and process, and with real impact on the daily lives of the people we represent. So I'll pass for the moment, but the key phrase there for you was probably "for the moment." Okay.
Right.
Let me turn to the clerk and ask if we have any members of the public who are queued up to speak on this item.
We do not.
All right, then Supervisor Lee, all we are asked to do today is receive the report. Can I get a motion to receive the report?
Yes, so moved.
I'll second. Before I ask that we call the roll, let me just check in with Mr. Marquez, who I understand is taking the lead on today's committee hearing. Mr. Marquez, anything else you want to ask or share with us that you think would be helpful for the board members to hear? I'm asking only because while Supervisor Lee is now a veteran of the board, he did not live through some of these earlier conversations that I referenced with Ms. Lowther and Dr. Miller.
I think they covered it quite well. I would simply add that, we have had very constructive group of folks meeting over time, and I participate in those meetings myself, and so can attest personally to the learning that's going on there, the creative thinking, and the work that's being done, so we can present something that's going to be hopefully of interest to the board and will help solve problems for the very important reasons you mentioned just a minute ago.
All right, thank you very much for that. We'll ask the clerk to call the roll, please.
Vice Chairperson Lee.
Aye.
Chairperson Simitian.
Aye. Motion is carried. Report is received. Thank you, Dr. Miller. Thank you, Ms. Lowther. Thank you, Mr. Marquez. All right, that takes us to item number 10, which is to receive the report from the Valley Health Plan. And this is in connection with coverage expansion. Who is going to present on behalf of Valley Health Plan?
Hi, Supervisor Simitian. This is Laura Rosa, CEO of Valley Health Plan.
Thank you, Ms. Rosa. Go right ahead.
Yes. So this is our coverage report. It covering Pcap, Medi-Cal, and our outreach activities. So as of course you are aware, this body, the Board of Supervisors, had increased the eligibility of the primary care access program known as Pcap to 400% of the federal poverty limit. To date, that has increased our membership to 1,200, with a large number of those, I think around 600 to 800, being in that higher income bracket. We are continuing to ensure that we're enrolling and supporting the clinics to enroll the members as well as the VMC enrollers. As you also are aware, AB 133 has increased the eligibility for Medi-Cal to those who are undocumented up to the age of 50. We expect that we might see a decrease in Pcap of around 3,000 enrollees. But again, given some of the concerns that we've spoken about previously around the public benefit charge, which never went into effect, but caused a great chilling among the community, we may or may not see those numbers actually roll off of Pcap into Medi-Cal. This is an area where we're going to provide substantial outreach and working with our community partners. The Pcap clinics include the 9 community clinics that are part of the Community Health Partnership, as well as Bay Area Community Health and Roots. We have ongoing conversations through our value-based payment and quality program with all of these clinics, and Pcap is a part of, we work closely on Pcap as well. VHP is also working with Santa Clara Family Health Plan to develop capacity to enroll potential enrollees at the Blanca Alvarado Community Center. That is where the satellite office for FHP is located. So we're working on that capacity. In terms of Medi-Cal, there has been a suspension of the redeterminations. So we're not. So that isn't something that it looks like because of the extension of the public health emergency that will continue, and so we don't see it. We will probably not see a drop in Medi-Cal. And then Covered California, which did end its special enrollment period, but does still have some enrollment based on some criteria, change of job or location or region. There's some small segment there where people can enroll. Those subsidies have increased to make the Silver Plan much more affordable. And the Silver Plan has much less cost sharing, less deductibles and co-payments. So that's a good thing. And that's one of the reasons why the Biden administration put more of and Covered California have put more funding towards the Silver Plan. And then we continue to do a significant amount of outreach, as I've said, working with our clinics, working with the enrollees over at enrollers over at VMC, and also working with VMC on the Medicare program and pushing that information out to our membership, which now is around 200,000 nearly. So we've got collaboration efforts going there. And I can take any of your questions related to any of this coverage issues.
Thank you. Let me turn first to Supervisor Lee, and then I do have questions of my own.
Yes, thank you. So of the 30,000 estimated and insured residents and eligible for Medi-Cal, approximately 1,200 have enrolled in Pcap. Does the administration have any target numbers and a projection for the Pcap enrollment moving forward?
So we've targeted 30,000. I think we've looked at a number of enrollees. We're pretty. I think we wanted to hit 13,000 this year, and so we're not far off of that, being that it's only May, and looking at the calendar year. And again, we'll see what transpires with Medi-Cal. But we are continuing to reach out to the community and plan events and try to get the word out and really try to use our community partners to expand the message and get people enrolled.
Yeah, for the outreach is key. So please do let us know of anything we could do from our point of view as well, from the different districts. Now, the population Absolutely. We're targeting for Pcap expansion, as we know, at times can be difficult to reach. So any insight on in-person outreach strategies that are currently being explored right now?
We are actually planning some strategies around the sort of day worker community, and we're happy to partner with any organization to get the word out and make them aware that Pcap is available. Obviously, the community clinics and VMC are really critical because that's where people seek care. And that's when, they're in the moment and they're looking for care, and that works very well. It's a little harder when people are not actually in that moment of I need care. Many people don't ever think they're going to really end up, if they're well, don't think they're going to become sick. So that's always a challenge. But again, we do a lot of community events and we continue to do that.
Okay, very good. Thank you. And that's all I have.
Thank you.
Thank you. And Ms. Rosas, let me just ask, I appreciated the information about what I think are roughly 1,200 additional Pcap participants. And the description, if I processed it correctly, is that we think we can attribute probably 600 to 800 of those folks to the fact that the Pcap program now has expanded eligibility in terms of income levels. Did I get that right?
That's correct. And I can get you exact numbers after this meeting.
Thank you. And notwithstanding the fact that you will, quote, lose some Pcap members to the Medi-Cal expansion, the first question I have is, you are likely to continue to get some growth in Pcap from the income eligibility, or do we think we've pretty much played that out?
No, I don't think we've played that out. I think there's still opportunity there. And I think it's really about communication and outreach. And I think there's several different populations that could, benefit. So we'll just have to see how it works. I think it's really about getting the word out. I think getting the word out on Medi-Cal is equally important. And there's a whole cross-county effort on that. Because again, the public benefit charge rule just became such an issue. It's created such fear in the community that really combating that and making people realize that rule never went into effect, that they should do this, that these programs are available and they're eligible for them and they're entitled to them. I think that's going to be the key messaging, and using, really utilizing our community partners is going to be critical.
And, obviously our committee knows, but could you just remind anyone who's listening who doesn't what the public charge rule issue has been?
Yeah, so I think this goes back to 2017. The Trump administration tried to put a rule out there that ended up, I think, going through the courts eventually, and if I'm remembering correctly, and Mr. Margolis may actually have a better memory on this than I do. But basically, if anyone wanted to make eligibility to become a citizen sort of discourage people from accessing various public benefits for which they were entitled to. For example, an undocumented woman who is pregnant is entitled to Medi-Cal, for example. But that was then wrapped into, well, if you actually enroll in these programs, it will make it harder for you to become a citizen. It was an actual rule that the Trump administration tried to put together. And it eventually was stopped. But, the word got out there, along with the general fear mongering that occurred around the wall and all the other verbiage and rhetoric. It created that a significant atmosphere of fear. And that, unfortunately, has continued and made many efforts around public health and healthcare much more difficult in reaching these populations, engaging them, and having them enroll in programs for which they're absolutely entitled.
Thank you. Mr. Press, you want to give us a refresher, or Mr. Margolin? Either. I'll go to Mr. Press first.
Yeah, sure. I was just going to jump in. Thank you, Laura. I just wanted to note that we've talked about this earlier in some earlier meetings, but this board authorized one of the first lawsuits against the public charge rule some time ago. I think it was in August of 2019. And so our efforts, in combination with a lot of other efforts around the country, did put a stop to the public charge rule. And the particularly surprising / insidious thing about the public charge rule is it entailed a really drastic departure from decades of interpretation about what types of benefits would be considered sort of part of the public charge concept. To reach things like health benefits and other things that had just not been on the table before.
And Mr. Press, excuse me, had the rule been implemented, being a public charge, would have had what consequence?
It could have had all sorts of consequences in terms of people who are trying to adjust status. It could have literally been a basis for denial of adjustment of status to obviously something more favorable. So it's really quite consequential. And to Laura Rosas's point, it's very difficult to convince people, once something like this came to the brink, that it just sort of magically disappears. And so, yes, an enormous amount of effort, public education effort, I think, needs to continue to occur to remind people that the public charge rule is not in effect and that they can comfortably seek healthcare benefits without fear of having information reported to, the wrong authorities, as it were.
Thank you, Mr. Press. I'm going to go back to Ms. Rosas with my follow-up question, and I think that's it for me, Ms. Rosas, which is you mentioned in passing that you thought that with the new eligibility that's been announced for Medi-Cal, that would presumably, in all likelihood, result in perhaps 3,000 fewer folks in the Pcap program. That being said, it's a good thing for our county and it's a good thing for the residents, yes, because the folks who previously did not have an insurance product to cover their costs will now have Medi-Cal as an insurance product, yes?
Absolutely. Yes, absolutely. It's a good thing.
Okay. And that's good for them. And it's also good for us because there will be a place to go to be compensated for the service the county has to provide and wants to provide, obviously. All right. I don't have anything else. Supervisor Lee, I'll ask for a motion to receive the report.
So moved.
And I'll second. Let me check with the clerk, see if we have any public comment on this.
We do not.
All right. Please call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye. Motion carries unanimously. Thank you, Ms. Rosas.
Thank
Stay
you,
there.
supervisors.
Thank you. All right. That takes us to item number 10. And we have, just for those of you who are trying to keep track, A, C, D, E, F, and G remaining because we picked up items B and H already. Let me ask our director, Mr. Santiago, what would you like to share with us under 10A?
Yes, good afternoon, Mr. Chair and Vice Chair. Really appreciate the time. We have a written report for you that details some of the updates that you got. You also receive, obviously, from Mr. Margolin and Ms. Rosas on coverage expansion and the status of federal policy. Just a couple things to highlight for you. One of them is it gives a little bit more detail in terms of the status of the premium subsidies. The issue that was you mentioned is linked to the public health emergency, and when and if the public health emergency goes, obviously those are at risk, although there might be a solution at the federal level about that. Also give you an update on behavioral health parity. I know that's been of a particular interest for you and this committee in terms of progress. There's 2 referrals. We started to work as part of that in response to those, and we'll give you updates as we come along, as well as the specific request to come back in June and give you a more comprehensive update. And we're also providing some updates on both the state budget as well as some of the key legislative proposals going on in the state of California and Sacramento that you're particularly interested in as a committee. So I'll end it there unless you have any questions related to any of those updates.
I think the only thing I would offer by way of comment, not question, which really does deal with behavioral health issues, but since you raised it, I was struck by the engagement of my colleagues on the Board of Supervisors at our most recent board meeting, Mr. Santiago, when we talked about mental health for the missing middle. Understandably, my colleagues were like, yeah, but let's make sure that insurers who have the obligation are accepting their obligation and responding to their obligation to cover mental health services so that that burden doesn't unduly fall on our county. So I'm pleased that you've mentioned the effort on Parity. As I know you know, but I just want to sunshine it here for the committee and others. I see these two issues, Parity and what I call mental health care for the missing middle, as inexorably interwoven. As I say, I was struck that at least a couple of colleagues were immediately making the connection, and I think it's important that the board and the public and the staff know that we have made that connection as well in our work internally. Let me turn to Supervisor Lee. Any comments or questions on 10A, Supervisor?
No.
All right, then that takes us to 10C, which is to receive the report from the Chief Executive Officer of the Santa Clara Valley Medical Center.
Chair Simitian, Supervisor Lee, Paul Lorenz. Outside of your report, I have nothing extraordinary to report at this time. I will share with this committee that your hospital, actually your 3 hospitals, went through the Joint Commission Accreditation Survey, which occurs every 3 years. We have received full accreditation. I do want to compliment the staff for their efforts. It is a very intense survey, as you can imagine, both from a clinical perspective, leadership, et cetera. Again, your hospitals are fully accredited for the next 3 years, and we will continue to work on improvements going forward.
Thank you very much. Let me see if Supervisor Lee has comments or questions on 10C.
None. Thank you.
All right. Thank you, Mr. Lorenz. We're going to move on then to 10D. 10D as in David, and that is a report from the Director of the Behavioral Health Services Department. Mr. Rao, I think that's you.
Hi, good afternoon, Chair Simitian and Supervisor Lee. Sherry Terrell, Director with our Behavioral Health Services Department. I don't have anything to add aside from the written report, but we're open to any questions you may have.
All right. Supervisor Lee?
None for me this time. Thank you.
Thank you. Mr. Rao, what else would you like to tell us about progress on the 2 alcove efforts in our county?
Sure. Thank you for asking, Supervisor Simitian. We are making great progress on alcove. Alcove Palo Alto is fully up and running and serving many youth and young adults. We are still seeking a site for the San Jose location, but in the interim are continuing to provide both virtual as well as other similar alcove-like services to youth in the San Jose area. We are continuing to staff up the programs, continuing to work closely with our partners in ensuring that we're able to deliver the services. We have been acknowledged through a few different awards for the alcove program, which we're very proud of, and just continue to make positive progress in serving youth and young adults through these services.
All right. Ms. Terrell, I want to confirm my understanding, which is that the path forward that has been decided upon for the San Jose alcove site, which, as you referenced, involves some virtual work, some work at what I will call a drop-in center, and the eventual location or relocation in a new and different site has us on the same page with our partners at Stanford, yes?
Yes.
All right, thank you. All right, Supervisor Lee, one last call, and if not, we'll move on to item 10E, which is to hear from the CEO of the Valley Health Plan if there is more to hear from Ms. Rosas. Anything else?
No.
All right. Ms. Rosas, would you like another opportunity to talk about other aspects of your efforts?
Only that we're just coming up to 200,000 members, and we continue to work on implementing Epic's Tapestry as one platform for all of our activities and claims, et cetera, and all is going well.
All right. Anything you want to share about Covered California, as long as I have you here as a one-person focus group?
Not at the moment. There is a extension of the COVID-19 public health emergency So there is a new qualifying life event. So there is some ability, even though open enrollment is over, there is a little bit of wiggle room there, as I alluded to earlier, for enrolling. And we are preparing, of course, as always, for outreach for when it reopens again towards the end of the year.
All right. That takes us to 10F, which is the report from EMS. Ms. Lowther, Dr. Miller, anything else that we didn't cover earlier? Feel free.
Just a couple things very briefly. One is we have been extremely busy for the month of May. Normally month is not quite this excessive. Call volume up over the 400s on a daily basis. But I would like to mention what an outstanding job the staff in the community hospitals have done on stroke outreach with our stroke awareness campaign. Really have done an excellent job. And you will see ambulance patient offload updates on a monthly basis for your perusal. And any other questions you might have, we are here to answer.
Thank you. Let me check in with Supervisor Lee.
Nothing from us. Thank you.
Thank you. All right, then I think we're good to go. Thank you, Ms. Lowther. Thank you, Dr. Miller, again. That takes us to 10G, which is the report from Custody Health Services. Dr. Day, I don't know if you're here or we're hearing from someone else today.
Yes, Dr. Day is not available today, but we have Ms. Pratima Pandey available to you in case you have any questions. They have a full report on vaccination status.
Right. Thank you. Supervisor Lee, I'm good with the written report. Any questions for Ms. Pandey?
None from me. Thank you.
All right. Thank you. Thank you, Ms. Pandey. I'd say you got away clean this time. Good for you.
Thank you, Supervisor. I appreciate it.
All right. And let me check with the clerk to see if we have any public comment on item 10, A through H.
We do not.
Then I will ask my colleague Supervisor Lee for a motion to approve item 10, which is to consider the recommendations and which involve report receipts on all items.
Yes, so moved.
Motion by Lee, second by Simidian. Please call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye. And that motion carries unanimously. Supervisor Lee, that puts us in the uncharacteristically early place of being too early on our agenda to take up the 4 o'clock time certain item because it has been agendized for 4 o'clock. So I'm going to suggest that we take another recess and that we reconvene at 4 o'clock sharp. And we take the matter up then and ask staff to be available at that time so we can take it up on a timely basis. Okay?
Perfect.
All right. Then without objection, we stand recessed until 4 o'clock sharp. Thank you all.
Thank you.
Hi.
I was gonna say, are you just dialed in there?
All right, Madam Clerk, I believe. Thank you, Madam Clerk. I believe we are at the hour of 4 o'clock. Can I ask you to go ahead and establish the presence of a quorum yet again, please?
Yes, Vice Chairperson Lee
Present.
and Chairperson Simidian.
Thank you. Present. That takes us to item number 11, which is to consider recommendations to strengthen the enforcement of local regulations on the sale of tobacco and vape products. This is an item that is a time certain. You will note on the agenda that says the item cannot be heard earlier than 4 p.m. And so I am double checking my timepieces here, including my cell phone. It says 4 o'clock has just arrived. So let's go ahead and ask for the staff presentation on this item before we take comments and questions from Supervisor Lee and myself. And then we'll also hear from members of the public if there are interested parties on the line. Thank you. Go right ahead, staff.
Good afternoon, Chairperson Simidian. This is Dr. Cody. We have a team who will be making the report. They will introduce themselves before they get started. So let me turn it over to Nicole Cox and team. Nicole?
Thank you, Dr. Cody. Can everybody hear me okay?
Very well. Thanks, Nicole.
Loud
Great.
and clear.
Perfect. Well, good afternoon, supervisors. First, I wanted to mention that I'm joined today with my colleagues from Environmental Health. I have Rochelle Gotti, Acting Director of Environmental Health, and Beatrice Santiago, Acting Director of Consumer Protection Division. Additionally, we do have Lead Deputy County Counsel Michael Rossi and Deputy Counsel Jenny Lamb are also available for questions as we get there. And I'll just take a few moments to quickly summarize the report and mention that we're available, obviously, to take questions. So following the discussion at the February Health and Hospital Committee meeting, the Public Health and Environmental Health Departments worked with County Council to evaluate implementation and enforcement of the county's tobacco retail permit ordinance in order to identify current challenges and solutions to address these enforcement challenges. Additionally, we conducted analysis of other cities and counties' tobacco retail policies to better understand how the county's requirements line up or perhaps don't line up with other jurisdictions. Based upon that work, we outlined a set of recommendations before you today in order to enhance the county's ability to enforce our tobacco retail permit ordinance, as well as a timeline and plan for our outreach and coordination with our city partners. So we're here today to provide this report to seek any additional feedback on the proposed set of recommendations prior to returning to the board in June. This concludes our report, and we're available to take any questions.
Thank you very much. Supervisor Lee?
I don't have any question at this moment. Thank you.
All right, thank you. I do have a couple of questions and comments, but I think notwithstanding my earlier comment, what I'd like to do is go to public comment if there is any at this time. Let me check with the clerk. Do we have public comment?
We do. Hands are going up and down. Looks like we have 4 public commenters at this time.
Let me go ahead and allocate the 2 minutes, which is our norm for public or for comment on agendized items. I do just want to say, because I know some of the folks who are interested in this issue are not regulars on this committee, if there's a critique or an area where you find a proposal wanting, please help yourself and help us by saying what you'd like to see instead. In other words, if you don't like blue, tell us you'd like red, so we know that that's what you're advocating for. That's usually a little more productive than a sort of a generalized observation. And the second thing for Dr. Cody's team, I just want to confirm this item will actually come to our full board for debate and deliberation and presumably action. Today's hearing is just a first opportunity for us to review and comment. Yes?
Yes, that's correct. Our plan is to come to the full board that second meeting in June.
Which is the 28th of June. And I say that both to confirm, but also to provide clarity to members of the public who may be wondering, well, what's happening today and what's happening later. The answer to that question is formal action will be scheduled for our second meeting in June. This is essentially a way station along the way. And if someone needs to mute there we go. Thank you for that. All right, Madam Clerk, let's go to the public. Thank you.
Okay, let's set the timer up for 2 minutes. Our first speaker will be Indira. Indira, you will have 2 minutes to speak. The timer will begin once you begin speaking.
Okay. Oh gosh. Sorry.
Indira, your mic is now live. We can hear you.
Okay. 1 second, please. 1 second. Good afternoon, Supervisors Simitian and Lee. I'm Indira Selva Kumaraswamy, a mother to a middle school and a high school in Palo Alto, and I'm active PTA member at my children's school, and I'm currently the VP of Health and Wellness for the Palo Alto Council of PTAs. We thank and applaud the staff for the report and for providing stiffer penalties, but stepping back or holding up the enforcement while waiting for all the cities to adopt the stiffer penalties is not going to solve the huge problem we are facing, and not to mention the young lives we are losing. Time is of the essence, and we feel that the county needs to act with utmost urgency to quickly enforce the ordinance on the repeated offenders and do what it takes to make them obey the law. This will send the message to all parties that the county is very serious about this issue and cannot be toyed with. Without enforcement or with minimal enforcement, the tobacco license law is useless. We are asking that the Health and Hospital Committee strongly recommend to the full Board of Supervisors to lean on stricter enforcement without any further delay. Our children are the future generation and their lives matter. Let us show them that as their trusted adults, we will take care of them and do our best to keep them safe. On behalf of all the parents whose children are hopelessly addicted to the vicious habit of vaping, and for those parents who are mortally terrified of our children falling prey to it and dying prematurely, I thank you for listening and for taking our concerns seriously.
Our next speaker is Vanessa Marvin. Vanessa, you will have 2 minutes to speak. The timer will begin once you begin speaking.
Good afternoon, supervisors. My name is Vanessa Marvin. I'm one of the co-chairs of our County Tobacco-Free Coalition. Our coalition works to provide education, cessation, to engage youth, and support enforcement on tobacco issues across the county. We wanted to thank you for your leadership by continuing to keep the focus on these issues and making sure that we're always moving forward to do the best we can to protect our youth and our most vulnerable communities. We are really proud of the county ordinance, and we're proud that so many Santa Clara County cities have followed the lead of the county supervisors to pass key provisions that you have, such as banning flavored tobacco. The proposals and recommendations outlined by the staff and being discussed today sound like a good step to take to an already good, strong policy to the next level. I appreciate the focus of looking to find these loopholes and close them, and making sure stores can't just simply hide products, for example, and making sure that the violations are stronger with increased penalties. So thank you again. We look forward to continuing to work together with you and the County Health Department to protect residents of this county from the harms of tobacco.
Our next speaker is Jade Chow. Jade, you will have 2 minutes to speak.
Good afternoon. My name is Jade Chow. I am a parent and member of the PTA and former president of the Palo Alto PTA Council. The PTA Council is a member of the 6th District PTA, and that our council represents 17 school PTAs and teachers, parents, and student PTA members. As a parent with 2 teenagers, I implore you to take enforcement action against shops that are selling highly addictive products to our teens, and continue to do so despite a law that has been on the books. In 2020, at the beginning of this pandemic, we started a statewide effort to educate parents on how our kids were getting addicted to this new tobacco product, vape, Juul, flavored tobacco, social media influencer ads on TikTok and Instagram. This resulted in a California State PTA resolution overwhelmingly supported, and I mean overwhelmingly supported, 99% by PTA members. Now in 2022, 2 years later, parents, educators, and teachers are truly aware of this problem. We have done our part. Please do your part. Parents like me are begging you to look to enforce the law on the books that prohibits selling flavored tobacco products to kids in our community. Don't settle with shops that violate the law. We note in the staff report that the penalties have increased from 100 to 1,000, 500 to 1,500, and thank you for that. But having stiffer penalties that are unenforced, not taken seriously, and not prosecuted by the county council is basically no good. We thank the staff for drafting the report. We ask the committee to make the strongest committee recommendation possible to the full county supervisor board to step up and diligently enforce the law so that countywide, our kids, grandkids will not become the next generation of citizens who will suffer ills and diabetes and heart disease. Thank you.
Our next speaker is Eileen Kim. Eileen, you will have 2 minutes to speak.
Hi, my name is Eileen Kim. I'm a Palo Alto resident with 2 children in middle school. I'm a pharmacist by training. I have a PharmD degree and used to work both in community and hospital pharmacy. I want to share a story that is all too common in our community. This involves a Palo Alto family whose son attends Gun High School. They moved to Palo Alto from Chicago and were new to the area. The son wanted to fit in and unfortunately fell in with the wrong crowd and started to smoke vapes. He quickly became addicted. And while other kids went to camp and jobs and helped around the house, this young man went to rehab that summer. Here's the thing, that young man is still addicted to vaping despite having gone through multiple rehab stints. So you might be wondering, why couldn't this teenager have quit vaping even after having gone through rehab? The answer lies in the addictive nature of vaping. It's highly addictive, and there are no FDA-approved therapy or treatment for vaping addiction in youth or children or teenagers. And this addiction goes beyond just the mere chemical addiction. There's also a psychological addiction that's happening, as well as the instant drug delivery system from inhaling the chemicals that gets immediately absorbed and provides this instant drug reward feedback mechanism loop that's very difficult to break as a habit and is incredibly powerful. And there's also the social habit of vaping once the young person starts. So there is no cure to this addiction. That is why we are asking you to help us to make sure that vaping is not a habit young people start. Because of this easy accessing of e-cigarettes from retail and vape shops, and the children that still have developing brains and bodies, it's imperative that's better enforcement of these shops. Our children's health is at stake. Thank you.
Our next speaker is Blythe Young. Blythe, you will have 2 minutes to speak.
Hi, everyone. My name is Blythe Young. I'm the Community Advocacy Director for the American Heart Association. I want to assure Santa Clara that your policy is very strong and it's the model that we recommend to most jurisdictions. However, in your pursuit of implementing your policy, I would suggest looking at your penalty fines or your fees and ensuring there's enough money to follow up on violations, that your staff has enough funding to follow through when there is a violation that occurs, and that there's enough funding to ensure that the compliance checks are happening at an adequate frequency. I would strongly recommend that you keep your suspension structure that you have. It's very strong, and just make sure that you have enough staff in your program to adequately enforce the policy that you have, because it seems to me like that is closer to the issue, but I also agree with your proposed amendments to your policy. I would also like to see something added that holds the licensee accountable for any monetary penalties so that there isn't passed through to minimum wage earning clerks, as well as it's really great to state that enforcement and compliance pertains to retail sales and not to purchase, use, or possession by youth. Thank you.
Our next speaker is Erwin Morton. Erwin, you will have 2 minutes to speak.
Thank you. My name is Erwin Morton. I'm a 40-year resident of the county, and I am the Vice President for Advocacy of Santa Clara Valley PTA, which serves kids throughout the county. A few years ago, I got lost in an unfamiliar neighborhood, and confused by a profusion of signs, I made what I mistakenly believed was a legal U-turn, with a police car right behind me. No one was endangered. I didn't do it for profit. It wasn't a deliberate violation, and I wasn't a repeat offender. But I was clearly in the wrong. So of course I was stopped and ticketed and paid the penalty without question. If what I've read in the newspapers is correct, a shop has been caught repeatedly selling to children products that cannot be sold legally even to adults. Children are being endangered for profit, and the violation is quite clearly willful and intentional, since it is not legal for the shop to have this inventory at all. The retailer is clearly aware of the ordinance, having argued against its adoption. But instead of promptly enforcing a license suspension, the county is reportedly discussing a settlement with the shop. So one violation here is inadvertent and victimless. The other is a willful and repeated crime for profit against our community and its children. A shop licensed to do business is thumbing its nose at the community from which it profits. I thank the supervisors for considering our concerns, and I'm pleased that the staff report recommends increased penalties for violations. But a penalty not imposed is not a penalty at all. So I'm here today to ask for enforcement that is swift and certain. Thank you so much for your time and consideration.
Our next speaker is Carol Baker. Carol, you will have 2 minutes to speak.
Thank you. I'm Carol Baker. I'm co-chair along with Vanessa Marvin of the Tobacco-Free Coalition of Santa Clara County and a volunteer advocate for ACS CAN. I have a question for you. How many penalties for not following the regulations have taken place? I think I can probably answer that with an estimate of about 0 to 1. And I think if we have regulations that we need to make sure that they're followed. So please enforce the regulations, but please do not punish the children who succumb to the attraction of tobacco. Thank you.
Our next speaker is Evan P. Evan, you will have 2 minutes to speak.
Hi, I'm Evan Pasalakwa. I am a current senior at Palo Alto High School and the founder of Youth Nicotine Addiction Awareness, which is an organization focused on community outreach to educate local high school and middle schoolers on the dangers of nicotine products and nicotine addiction. So when I began high school, vaping quickly became an apparent issue. And during my sophomore year at Palo Alto High School, within the first few months, we were averaging around 1 to 2 fire alarms triggered due to vaping in the bathrooms each day. And so in my personal experience, the bathrooms and other areas of campus became nearly impossible to use because of the frequent encounters with people that were vaping. It got to the point where people had stopped using them, and I knew that many of the students who had begun to be exposed to their peers doing that began to casually use vapes and eventually pick up the habit due to the ease of access and exposure to them. It became apparent that they were picking up on the symptoms of nicotine addiction, and it had a clear negative effect on them. So as a result of this exposure, I started an organization to educate middle school and high schoolers on the risks of nicotine addiction with hopes to prevent this problem from developing further. And in my time speaking with them, I found that I believe it's far too easy to access vapes, even as a teenager, which has allowed students that may not otherwise experiment with vaping to fall victim to it. I believe that the policies posed to prevent the sale of vapes would significantly contribute to the prevention of the spread of vaping products and nicotine addiction in middle schools and high school. Thank you so much for your time.
Our next speaker is Urvesh Kumar Mehta. You will have 2 minutes to speak.
Thank you very much, Board of Supervisor. I want to mention about 13 states, 2 territories, and 841 municipalities have outlawed the vaping in a smoke-free public areas as of April 2019. And regulation of 40 US states, our law defines that tobacco products may allow e-cigarettes to avoid a smoke-free laws, taxations, and the restrictions on the sales and marketing. It is equally important to note here that the California, which is a tobacco and vapor sales ban, and tobacco and vapor 21 law passed on December 2019. Hence, the FDA stated the law became effective and continued with the fact of bans of the sale of a tobacco and vapor products to the adults under the age of 21 years. Also, there is a ban for the flavor bans as well, which prohibits the sale of a closed system devices with containing the e-liquid in the flavors other than the tobacco and a menthol as well. There's also been instances that the law has defined that, how the electronic cigarette cartridges solution for filling electronic cigarettes must be sold with the respective packaging. So it is important to recognize the fact about that, how different tobacco products as well as the vaping products, they influence the different public grievance areas, and as well as what cities, along with the county, what cities are implementing those laws, and especially around the schooling areas, and making it effective on the day as of the year of 2019. The sooner it's being implemented, the better evolution will come out after the implementation. It's important that the county passes the ordinance, and as well as so would be the city, in order to protect and also taking the prevention measures from it.
Our next speaker is Stephen Lee. Stephen, you will have 2 minutes to speak.
Good afternoon. My name is Stephen Lee. I'm the Vice President of Advocacy for the Palo Alto PTA Council. It's been over 8 months since I had reported to the county that the Raw Smoke Shop here in Palo Alto was selling vaping products against Palo Alto's vaping ordinance, an ordinance that the county has agreed to enforce. This wasn't the first time this retailer has knowingly and wantonly violated our local ordinance. They've done so many times before and many times since. I know this as a resident of California Avenue. I routinely see teenagers and others go in and buy things that they shouldn't. And I hear the same from other parents and community members that this continues to be a problem. Despite this, the county has not done anything to actually impose penalties on this retailer. Not even the smallest fines or the smallest license suspensions have been levied, not for the first violation or the second or the third, or the many violations that the community has witnessed over the past year and a half. The county is simply not dealing with a good faith actor here. This retailer is a bad actor who is continuing to take advantage of the county in order to do business in violation of our local ordinance, endangering our youth and others in the community with no penalty or recourse. At this point, the county has become complicit and is condoning this bad behavior, and we as a community can no longer stand for this. We strongly encourage the county to step up, to direct staff to suspend settlement negotiations and actually enforce this ordinance and impose actual sanctions. While the ordinance isn't perfect, and while the penalties can certainly be beefed up and other tweaks can be made to the ordinance, we as a community are skeptical that any of these things will be effective if we can't count on the county to do what is minimally required and minimally expected under the ordinance as is. We encourage the county to step up and do what it can to impose real sanctions against these bad faith actors. Thank you.
Our next speaker is Tanya Papapilli. Tanya, you will have 2 minutes.
Good afternoon, supervisors. My name is Tanya Payapilli. I am a parent and I am the Deputy Executive Director at Breathe California, your local lung health leader since 1911. First, I want to thank you for your efforts in keeping the County of Santa Clara the national leader in protecting lung health and the health of residents, especially children and youth. While going through the report, I noticed the number of notices has increased for violations in selling to underage persons from 0 to 6. For the last 2 years, it was 0, and now it's 6. So clearly, it's showing that since the February meeting this year, there's something happening and the enforcement actions are working. But we have to keep in mind that there are newer products now in the market that can be used to vape a variety of substances. And the retail environment is emerging and adapting to find ways to still sell unlawful products to prospective customers without keeping it on the shelf. This definitely calls for expanding our ability to recognize such problems in the county and further strengthen the current laws with the recommendations that are provided in the report, like increasing the fines and penalties. Breathe California supports all of the recommendations that are listed there, and we are here to support. Smoking and vaping are addictive, but quitting is harder. So we are running out of time to stop this cycle of addiction. Please consider the enforcement with the recommendations in the report as soon as possible. Thank you for your time and consideration.
And that concludes public comment.
Thank you, Madam Clerk, and thank you to all who took the time to share their thoughts. Let me ask if Mr. Rossi, who was introduced earlier, is still available with the group from Public Health and Environmental Health. There he is. Mr. Rossi, good afternoon. How are you?
I'm well, thanks. How are you, Supervisor Shamidian?
Doing okay. I wonder, as the person in the County Counsel's office who deals with some of these enforcement issues, if you could share your thinking, or perhaps more officially the thinking of the Counsel's office on when to penalize and when to settle. And I'm not asking you to comment on a specific case. Obviously, I'm asking you to address the larger issue that we've heard from some members of the public on today.
Right. And thank you for that question. That's a great question. I don't think that the two are mutually exclusive. Even when the county settles a matter and enters into a compliance agreement with a business, that does not mean that the business does not pay penalties or serve a suspension. To the contrary, we seek to have penalties imposed regardless of whether the matter proceeds before the Office of the County Hearing Officer.
Is the, could you remind me, forgive me, I think it's in the report and I just can't recall. Is this item coming to the full board at our first meeting in June or our second meeting in June?
I don't recall. I'm sorry. I know it's in June. I don't remember which meeting we settled on.
Supervisor, if I may, this is Nicole with Public Health. The plan is for it to come to the second meeting, June 28th, to the board.
Thank you, Nicole. We're going to identify you as Mr. Rossi's phone a friend next time we have a meeting. All right. So thank you for that. I think the challenge in today's hearing, Supervisor Lee and others, is that we have 3 or 4 different issues about which folks have expressed some concern. And it's easy, if we're not careful, to confuse or conflate some of them. So I want to try and parse them out. And whether it's environmental health staff or county council, please, if I slice and dice the issues incorrectly, please feel free to step in and correct. On the issue of the ordinance itself, what I'm going to ask Supervisor Lee for in a minute is a motion to refer this item to our Board of Supervisors at second meeting in June without a recommendation, but with direction to staff and county council to identify alternatives or options for strengthening both the ordinance and the enforcement effort. Mr. Rossi, was that clear in terms of the direction? If I can get a motion to that effect in a minute from Supervisor Lee?
Yes, that's clear, Supervisor.
And environmental health, was that clear for you as well?
Yes, that's clear.
Thank you. And let me just walk through a couple of these things quickly so you know where at least one member of the board is. I do think it is hard to explain, justify, hard for folks to understand why people get third and fourth choices, or excuse me, third and fourth opportunities to violate. I think where there's a willful violation or what appears to be a willful violation, Mr. Rossi, I don't remember an awful lot from my first year in law school, but I do remember the tort professor who told me that in California, every dog's entitled to one free bite. I don't know if you heard the same thing when you were in law school, but the notion was, look, the first time your dog bites somebody, all right, that may not have been negligent because you didn't know he was prone to bite. But if he bites a second time, you are on notice because you've already seen and observed the behavior. So, that's when some notion of negligence attaches. And in this case, we're not talking about negligence. We're talking about willful conduct. And so I do think having some discussion at the full board about why folks are allowed third, fourth violations is probably appropriate. Whether or not, then the second piece of that for me is whether or not the penalties are sufficient to serve the primary purpose of a penalty, which in my view is or should be deterrence. And, I'd like some discussion about whether or not you think that's the case. And again, forgive me for mixing metaphors and venues, but you and I have talked about Lehigh Cement Plant and Quarry, and the fact that, millions of dollars later, it appears that penalties in that case are just assumed to be a cost of doing business. I want to make sure that if we have these fines and or penalties, they serve a deterrent purpose, which is to stop the behavior that is unlawful. And if not, have some conversation about what does it actually take to deter folks from engaging in the behavior. Because if they're just folding it into the business model as a cost of doing business, I don't think that's serving anyone well, except for the bad actors. And in fact, it does a disservice to folks who are out there in business following the law. And then finally, this issue of what it would take to step up enforcement. I think we all know, and I think people have frankly been very understanding and sympathetic about the fact that there have been other challenges in the public health arena the last few years. But at the end of the day, if this is our responsibility, we can't say, gee, it's hard or we've been busy. We got to say it's our responsibility as a county. And we have to ask ourselves, what does meaningful and effective enforcement look like? And if there's an impediment to providing meaningful and effective enforcement, what will it take to produce that sooner rather than later? Does that give both environmental health and county council guidance? If I can get a motion from Supervisor Lee in a minute to that effect.
Yes, I'll be happy to make the motion, but I do still have a couple of questions, if I might.
I will do it. I'll take that as a motion from Supervisor Lee. I will second the motion. Mr. Rossi, does that give you clarity about what we're hoping to talk about in addition to the material that was brought forward today?
Indeed, and I can also inform the committee that those discussions have been ongoing between County Council and the Department of Environmental Health and Department of Public Health already.
All right. Environmental health, clear about what we're hoping to have before us in June so that we don't say, gee, we got to come back yet again when we have that conversation at the second meeting in June?
Yes, Supervisor Median.
Great. And the last thing, I think we had some discussion from some members of the public about an individual case, and I just want folks to know I heard it, and I also hope they'll understand that while the case is pending, County Council and Environmental Health are probably less likely to lean in on that, but at some point that case will be resolved, and look forward to having a better understanding of the thinking in that individual case. Supervisor Lee, you've been very patient. Thank you, sir. I appreciate it. Appreciate the motion. We have the motion on the floor. I've seconded it. We've heard from community. What else would you like to share in the way of comment or question, sir?
So initially, I just want to say, first of all, thank you very much for staff for this very thorough report of addressing a very serious issue that's affecting our youth. And I want to also thank all the speakers that came to address this committee on this very important issue. One question I just want to cover quickly is regarding the issue of, we talk about sales over the counter, but I also want to ask about the online sales and deliveries. There's some discussion about how there's an online check of the age through a database, and just wondering, have a guidelines. Is there any way that we could even do any type of enforcement regarding that type of a sales?
Thank you, Supervisor Lee, for that question. I think I'll turn it over to Jenny Lamb from County Council to respond to that.
Hi, Deputy County Council Jenny Lamb here. So the State Stop Tobacco Access to Kids Enforcement Act does allow for the County Council's office to enforce.
Okay.
Those types of sales are regulated under both the State Act as well as the Federal PACT Act.
Right. And at this point, would you say that does not seem to be as huge an issue, or is it, do we know that we have that problem as well along the over-the-counter type of a sales as being a problem?
I would defer to public health to answer that question.
Yeah, Supervisor Lee. So in terms of the data that we've seen from the last youth survey, for youth purchasing their own tobacco and vaping products, the predominant place that they're purchasing those are in stores, physical stores. However, we do see a small percentage that are acquiring those products through online means. And in some surveys, including throughout the pandemic, we've seen national surveys where that number is going up. So it's definitely an area where we have concern and want to continue to monitor, how youth are acquiring products and see if there is, enforcement action that we potentially would pursue in the future as we monitor that data.
Great. So if that's the case, I'm going to ask when the report comes back to us to see if you could add on to that issue as well, to see how we could do more or better enforcement to monitor those type of sales through online. I'll certainly appreciate when they come back to the full board.
And excuse the interruption, Supervisor Lee. I just want to indicate for staff and County Counsel's office, I think it's a very insightful question and suggestion from Supervisor Lee, and I would support that as well, at least for consideration. So just want you to know it's two supervisors asking in the motion. Go to it again, Supervisor. I apologize for the interruption. And now you're muted. I apologize, Mr. Supervisor Lee. Unmute. There we go.
Okay, here we go. All right. Thank you so much. Yes. The second point, of course, is regarding the current dollar amount for these violations. First, $100, second, $250, subsequent $500. And I really do think that these dollar amounts is probably from, I don't know how many years ago, but certainly does not reflect the cost of inflation and whatnot that we're suffering through. And there's a proposal of going up, I think the first one from 100 to 1,000 from staff. I think that's proper. I would care to say that we could just add a 0 to all three of them would probably be more appropriate given where we are right now. And really to show that the pain is there for somebody who's doing a second and third violation and more. Clearly, they are running a business and doing this as part of their cost of doing business. So I really do think that the penalty really should be significantly higher. So that would be my recommendation, and see if there's something that we could come back with. I certainly appreciate it. And again, I really do think that this is a very serious issue. I have two daughters right now in high school. And that is like one of the biggest issue that they are facing from their schools of the vaping at the bathrooms and various areas. So this is a very real problem, and I certainly thank the staff for putting a lot of efforts to making sure that these type of illegal sales by these merchants should be very, very significantly curtailed. Thank you.
All right. I believe we have a motion and a second on the floor. Any last comment from council or staff? Nope.
No, nothing from us.
Thank you again for the work. Much appreciated. And Madam Clerk, I think we have gone to all who raised their hands. Yes?
Yes.
And we'll call the roll.
Vice Chairperson Lee? Vice Chairperson Lee?
Yes.
Thank you. Chairperson Simidian?
Aye. Motion carries 2-0. We look forward to seeing the item at the board in June, pursuant to the direction provided by the committee. Madam Clerk, I believe that is our last item today, yes?
Yes.
Then without objection and hearing none, we stand adjourned with thanks again to all who participated. Take care all.
Thank you.